We are live with the HSpec podcast. Today I have with me Timi Leslie. She is the president of BluePath Health, and also the executive director of Connecting Better Health. So, welcome, Timi.
Hi, welcome. Thank you. Thanks for having me.
Yeah, I'm excited today because I want to learn a little bit more about you. So, why don't we just start there and tell us a little bit more about yourself?
Sounds great. So, yes, I'm the president of BluePath Health. We're a consulting firm out of the San Francisco Bay Area. I started it 13 years ago to really be focused on improving community health. And so we work with health plans, providers, policymakers to really drive change to better outcomes in our own communities. I also am the executive director of Connecting for Better Health, which is a nonprofit to accelerate data sharing across the state in California. Don't hear about that very often, but it's a really amazing organization where we bring together a really big tent of providers, payers, CBOs, associations, policymakers to really understand how we can better and be more supportive of data sharing across all sectors.
Awesome. Well, talk to me a little bit more about. I would like a little bit more about data sharing. It sounds like there may be even some bridges between the two things you're working on.
Absolutely. I think that it's been at the heart of my career from day one when I was a very young consultant and worked on a business plan for why electronic health records should move from paper to electronic. So very from the very beginning stages, I worked on the Santa Barbara Health Information Exchange that's well known as being one of the first HIEs in the country to be a federated way of ensuring that data or peer-to-peer of how data was getting moved from one entity to another. I still believe that we have a lot of work to
Mm,
do to be able to bring, real seamless data sharing in across healthcare, especially when you think about how we are blending and supporting the whole person, making sure that social services and the social needs are being met in addition to our clinical and medical needs. And I think we're just, starting to scratch the surface of being able to really understand what it takes to be able to ensure that people are well supported by the systems that we, uh, have as a real safety net. But we're getting there.
mm. So with data sharing, talking a little bit more about that too, what are the big challenges in healthcare today? And then if you were to snap your fingers and say the perfect future would look like this.
I think, why I'm really into, making things better is when you start putting the person at the center. And the best way to describe that and how we actually started a lot of the movement with Connecting for Better Health was asking a health plan, a Medicaid managed care plan, when one of your members becomes recently unhoused and let's say a street medicine provider runs across them and understands that they're recently unhoused, how does that information get to you, health plan, so that you can wrap around the services that are available to that individual right then, right there? And that just asking that simple question is really what brought everybody around the table. We don't have a good answer for that. And that is, I think if you can kind of snap my fingers, we would have that scenario solved.
Mm,
And and so to that point, that street medicine provider who runs across Timi Leslie, who's recently unhoused, would understand what health plan Timi Leslie is enrolled with immediately, and then be able to make sure that those services that are available either through the health plan or through the community are that person is, Timi Leslie is enrolled in them right away.
mm. Really important stuff. Um, so what would, what is the bridge between the work you're doing at Blue Path Health and Connecting for Better Health? Because I feel like there's a bridge there of some of the work you're doing.
Yes, I mean it's really natural. So Blue Path Health, we are always kind of putting ourselves into the messy middle, I call it, that way forward where it requires multiple organizations to come together and to solve big problems, whether it's in housing or it's in maternal health or right now looking at prior authorizations of bringing together plans and providers and often policymakers to be able to make sure that there's supportive policy, not policy that's getting in the way or actually, completely adverse to what is required to be able to make things happen. So I think it's really natural that I took the lead of being the executive director of Connecting for Better Health, because again, it's like putting ourselves in that messy middle and making sense of data sharing that is, the bedrock of so much of the big, what I look at as big, bold goals for healthcare. And we just can't accomplish them without seamless data sharing.
Hmm. Yeah. What are the biggest roadblocks? I mean, you listed a few of them, but I mean, I've seen as anyone within healthcare knows, is there's so many problems with the word data sharing. Like you look at data, it's like, oh man, like yeah,
I
there's
know.
some big silos out there. It's like what are some mountains out there that are just very difficult to move, and why are they difficult to move?
Yeah, I love that you bring this up because it is, I think there's this, I call it almost a black box approach where many organizations, hook up to a data intermediary and thinking with the thought that all my problems will now be solved, right? Like you're just hooking up to the hose and the data will start flowing. And in fact, I think we have to be much more disciplined to drive that real meaningful data sharing, that we make sure that that information is getting to the worker, the front line worker who needs that information right now, and then also to make sure that the information is getting passed on to the partner for that specific use case or for that specific workflow. And until we do that and really put time, energy into that work, I just don't think we're going to see much change in status quo. And so the work that we're doing at Connecting for Better Health, we have a design studio approach that offers organizations to raise their hand. So the very first one we did was with UC Davis, really large academic medical center in Sacramento. And they raised their hand and said, we need help on thinking about how we work with our housing partners. So we worked with them to bring together two housing partners in the community, two FQHCs, two health plans, to put that person in the middle and design a workflow around how all of them will come together to be able to solve for that person in the middle. And this person was somebody who was recently unhoused and then admitted into the hospital and then discharged. And when they were admitted into the hospital, they had housing, some temporary housing, and then they were in the hospital long enough that that housing then went away. So now they needed to be able to be placed back into housing. And how all of these, the discharge nurse and how the housing entities are able to really start working together with information that they need in order to make sure that when that person is discharged, can go right back into another housing situation. And if we don't like have people that raise their hand and say, I need help, and then bring all those organizations together, then we can't unpack what you just asked. What are those big mountains that need to be moved? And in this case, we found that there's a countywide housing management information system that the hospital wasn't connected to. So they needed access. So that, there's step one. Step two is that the managed care plans weren't sharing information that they needed to share of their membership to be able to get to a central point. So that's another opportunity. I think there's also just some of the big rocks I look at it as that need to be moved, the big boulders, is policy as well. And policy, it could be regulation, it could be standards, um, it could be compliance officers, that they all have the same understanding of liability and the rules. So when you're able to have multiple partners come together and understand what their role is to be able to make sure that this person's journey is successful, a lot of those compliance and risk management decisions become more aligned. And I find that that's one of the like the beauties of having a discipline like a design studio to bring organizations together.
Hmm.
I think
Yeah,
I may have answered your question
oh
with a
yeah, I mean,
solution too, but it's
absolutely.
working. It's really working.
That's wonderful. I mean, what important work. I mean, uh, literally healthcare is one of those industries where you think sharing data should be an easy thing and a no-brainer, but it's really not.
Well, and you know what's really interesting around healthcare? I think we're built on a mountain of faxing. And this is what's also just, it's just blowing my mind is how many people even know what a fax is these days, right? Um, I mean, and I'm not kidding about that,
Yes.
but if you walk into any provider office or a clinic or frankly health plan, you're going to see a pretty robust fax engine, and it really isn't helping us at all.
I thought that
And
was the wave of the future, Timmy.
I know it could be. Um, it's really interesting. I've seen organizations that actually have electronic, have the ability to be able to share, through an electronic means, and then it drops to fax on the back end so that they
Yes.
can move it to another fax. So, and so I think we're built on faxing, and we're going to have to, and maybe that's another mountain that needs to be moved. But I have seen some really successful organizations with some great leadership that has said no faxing, like just zero. As we move
That's great.
forward, the faxes get tossed out. So we're going to have to figure out how to move forward without that crutch. And then phone calls and spreadsheets. No more of that.
Yeah.
That's not how we're going to do business. I know relationships and trust and those phone calls mean so much, but we can do so much better if we have a shared care plan and that all of the information that we know about that individual that we're trying to help is in one place so that we don't have to keep asking the questions over and over and over again that can be not only stigmatizing, traumatizing, but we get it wrong,
Right.
right?
Right.
We just get it wrong. So,
Hugely
yeah.
important. Yeah.
I think what I'm really proud of, both at BluePath and at Connecting for Better Health, is I think we have created some really important collaborative channels, and we have new tools in the toolkit. So I would just really like offer to your audience that if you have a new piece of technology, a new innovation that is going to make meaningful change to the the healthcare community, to offer how do you kind of think through bringing that new tool into a community design studio, and then we have a sandbox where it can be tested and simulated at scale. But those tools exist, and we don't have to do this alone. And I also just really commend everybody that's out there, trying to move the mountains, and I guess just to know you're not alone.
Hmm. That's really great. Now, how can people, as they're like hearing that message, learn a little bit more about you and Blue Path Health, and also connecting for better health?
So, Connecting for Better Health, we're easy to find at connectingforbetterhealth.com. We are, as I said, a big tent. Everyone is welcome. We have meetings twice a month where we look at the bright lights of data sharing, either in the state or out of the state. We track all of the legislation, at least in California and also at the federal level, that's going to have impact to data sharing and have a point of view. We have, I think, just lots of opportunities for connection and collaboration. So it's really easy to get involved. And then at BluePath Health or at bluepathhealth.com, and we are ready to serve.
Awesome. Well, Timmy, it's been great having a conversation with you. I really appreciate it. The work you're working on is really important work with all the sharing and making sure it's easier to share. And I love the story that you shared because it's so it brings humanity to a point of
Yes.
understanding why the humanness factor of, oh my gosh, if we don't get this right, here are the ramifications behind it. So thank you for sharing
Yeah.
that.
Yes.
So
Thank you. Thank you for having me on.
absolutely. Thanks again. We'll
Okay.
talk soon.
Okay.